live at HMPS here in Orlando, Florida. Very active exhibit hall here around us, but I'm excited to sit down with Nathan Ziegler. Nathan,
Yes.
Welcome to the show.
Thanks. It's good to be here, Chris.
Well, it's glad that you're here. And, one of the topic that we're going to talk about is very interesting to me, and I think it's very timely. But before we jump into it, I'd love for you to share with our audience a little bit about yourself.
Yeah, great. Well, first of all, thanks for having me, and it's just great to be here at this event today. I lead diversity, equity, inclusion, and belonging for CommonSpirit Health, a large nonprofit healthcare system based out of Chicago. My work primarily focuses on engagement with employees, with our patients and our communities, ensuring that all people are receiving the care that they need and the care that they deserve. So, really leaning in and focusing on how we engage our communities and understand the diverse needs of our patients.
Well, if you don't mind, I'm going to hit the nail on the head here. Because
sure.
DEI has been like this verboten word. It's been politicized, whatever. But let's break it down to what it actually means, right?
Sure, yeah.
Because I think that's really, we have to understand that.
Mm-hmm.
Diversity, equity, and inclusion.
Right.
Explain to me exactly what that means for you.
Yeah, well, thank you for asking that question, right? So diversity really is the definition of who we are as people, our different gifts, talents, and attributes that make us each a unique and whole person. So diversity is really defining all of humanity. We are diverse by nature. Equity is ensuring that all people have the same opportunity for equal outcomes. So that word has been kind of flipped on its head, but really the essence is, how do we remove barriers to equitable outcomes and access? And inclusion's a behavior. Inclusion's an intentional action that we take to ensure that underrepresented, historically marginalized, and diverse voices are included in the conversation. Their insights are leveraged for innovation, for care. It really helps us close the gaps in terms of equity. So DEI, yes, it's been politicized, but it's just a definition of who we are as people and what we need to work towards as a healthcare system.
And I think it's really important in healthcare. I mean,
Yes.
we think about this, right? I'm on the digital side of healthcare. I understand that the data that we have is very biased at times because we're looking at data of patients that we've already treated or what have you.
Right.
But historically, that has skewed biased data. It doesn't give us the really good outcomes that we're looking at. So from your perspective, I'd love to hear about how these concepts are very important to the way we deliver care today.
Yeah, so, when you think about from a data perspective, one of the things that we led at my company was collecting our demographic information of our patients. When you have underserved populations, the data is naturally skewed because you have less of that data.
Yeah.
And so when we say, how do we really use statistical analysis to understand the dynamic needs of our patients across all geographies, right? So we have a health equity goal for all of our hospitals to close the gaps, and it looks at things like race, ethnicity, gender, sexuality, regionality, geography, disability. It's saying, what are the different needs of those populations, and how do we deliver the best care for them in those markets? And our data has to be, we have to have our arms around the data to be able to identify those unique and dynamic needs of our patients.
And it helps us outline where we're not meeting those needs per
Absolutely.
se. And the thing you're talking about, delivering the care to your community, I mean, that's part of your mission.
It's fundamental to our mission. CommonSpirit Health is a Catholic healthcare organization rooted in social justice. And so our core to our mission is making sure that we're serving the poor and vulnerable populations. And really, all of healthcare is supposed to be focused on that.
Yeah.
So, if we identify barriers and shortcomings that we might have as healthcare systems, it helps us provide better care. And at the end of the day, that's why we're all here, is to provide the best care to all people that we can.
So you've presented at this conference.
Yes.
Share a little bit about what you talked about in this.
Really applying that health equity lens to digital accessibility, right? When you think of accessibility from a digital landscape, certain populations don't have access to high-speed internet.
Yeah.
Or, mobile devices like the iPhone or computers. And so when we think of digital accessibility from a health equity lens, one of the things that we talked about was, how can we understand those different needs of patients and then close the gap around their digital accessibility needs. So our talk was really focused on, leveraging the insights from diversity, equity, and inclusion to solve some of those digital accessibility issues that certain communities have. If you look at some of our hospitals in North Dakota, they don't have the high-speed internet in those communities that they need to have virtual care, and they're 3 hours away from a hospital. So we have to really find creative solutions to get them the care that they need in really tough environments.
And I think that's important to understand, right? We're not talking out here about, this is about providing access to your community.
Yeah.
And it doesn't matter in that particular case. This is a geographical lens you're looking at, right?
Yes.
A rural community does not have access to broadband internet. So what are some of the ways that you're working to kind of cross those accessibility gaps?
Well, so, first of all, one of the things that we've done is we've implemented health equity plans in our hospitals. Mm-hmm. All of our hospitals across the footprint. And it's not really fair for me to say what a different hospital needs to do to close those different gaps. So what my team does is we reach into the community and understand what they see as a solution to some of these issues. So I don't lead our IT or our digital accessibility department, but we work closely with those groups to say, okay, what are some solutions to these problems, and here's what the community's saying. Mm-hmm. Here's what the patients are saying, and how can we kind of work together to bring those voices to the table? And that's what's, DEI, diversity is powerful. When you have, there's a guy by the name of Scott Page. He's a mathematician out of University of Michigan. And he has this equation for diversity. 1 + 1 = 3. One unique perspective plus another unique perspective equals a third unique perspective. If we have the same point of view, 1 + 1 = 1. So that's a power differential of 2.
Yeah.
So when you reach into the diverse voices of our community, then we can help solve some of the issues that they might have.
Yeah. And there's generational gaps too.
Oh, absolutely.
Right? I think about my parents accessing their care. They don't want to be seen virtually. They want to go in person, right? Mm-hmm. To the point where they're deferring care because it's going to take them a long time to go to see their doctor.
Yeah.
Right? An hour and a half away, and they don't have time to do that. These are things, too, that are also part of your equation, right?
Absolutely. That's a great example. My mom has a disability. She can hardly move. She has cancer. She has all these different ailments. And sometimes the thing that she really needs is virtual care. Yeah. She just needs to be able to get on a camera and talk to someone and talk about the issues she's having. That's accessibility in action.
Right.
And but she doesn't have the technological skills, sorry, Mom, to be able to access that on her phone. I have to get there and set it up and walk her through the profile and align it to her email and her insurance and all these things. So it's complicated, especially for generations of people that weren't raised with digital technology like we have been.
Right, and not everyone has you as their son to
Yeah,
help them,
right.
right? So this is where health systems, again, are meeting their mission
Right.
by determining ways that they can solve that, right?
Mm-hmm.
It extends into like food accessibility.
Right.
Social determinants of health play a big role here too, right?
Oh, absolutely. I mean, food accessibility, when you look at all the different social determinants of health, of food, environment, transportation, education, economic factors, when you put your arms around those different drivers of health outcomes and you understand where those gaps are, that's when you can start to say, okay, ProMedica, a healthcare system in Toledo, Ohio, has a food market right in a food desert.
Wow.
And when you think of, wow, what a solution to solving some of those needs when it comes to food inequities. Some of our hospitals really work on childcare and transportation issues with underserved populations. California Hospital, for example, has a childcare center right next to the hospital so that people can bring their children. They have green space, they have food, they have, lots of learning opportunities.
Wow.
That's how you start to close those gaps in outcomes. It's really based in the roots of the community.
I mean, it's really based on the roots of actually what healthcare was meant to do.
Absolutely,
right?
yeah.
We're not here to just serve sick people. We're here to actually provide health to our communities. I think it's great, Nathan, that you, despite the craziness of our current environment and the uncertainty of our current environment, that there are people like you that are still continuing to advocate for this for the right reasons.
Right.
I really appreciate that.
Yeah, thank you.
So thanks for your time today. This has been a great conversation.
Thank you, Chris. It's been good to be here. Thank you.